OK. Bonjour à tous et à toutes. Je suis Anne Lagacé-Dawson de la Coalition canadienne de la santé. Nous sommes venus à Ottawa de partout au Canada pour souligner l'importance de l'assurance médicaments. Nous avons rassemblé 5 travailleurs de la santé, frontline workers, de l'Alberta, du Yukon, la Colombie-Britannique et le Québec. Et on va commencer avec Pauline Worsfold. Canadians, in good Canadian slang, are getting hosed by Big Pharma. And putting in a universal pharmacare program would be an incredible and positive legacy for the government in power. We strongly encourage that. And as you're going to hear, there's lots of evidence to back that up. So I'm going to start by giving over the floor to Pauline Worsfold, who is a registered nurse and the chair of the Canadian Health Coalition.
Thanks, Anne. I'll just start by saying the Canadian Health Coalition acknowledges the City of Ottawa is built on unceded and unsurrendered Algonquin and Anishinaabe territory. As Anne said, I'm Pauline Worsfold. I'm a registered nurse. I'm the chairperson of the Canadian Health Coalition. I've been a registered nurse for 43 years. I live and work on Treaty 6 territory in Edmonton in the post-op recovery room at a large teaching facility. And the Health Coalition has been working on pharmacare for over 2 decades. We are here with over 100 participants for the next few days, bringing our concerns and our solutions to MPs on Parliament Hill as part of our Health and Hope campaign with Canadian Health Coalition. Our group is made up of labor unions, representing health workers, nonprofit groups, community groups, healthcare experts, and scholars. We've come to Ottawa from all over the country. We have Vivian from the Whitehorse, Yukon, Frédéric from Quebec City, Quebec, Kieran and Jing Yi from British Columbia, and our message is very clear. We need pharmacare now. Pharmacare is not a blue party or a red party or an orange party or a green party or a bloc party issue. It's a human issue. People living and working in Canada are having to choose between heating their homes, putting food on the table, or paying for their prescription medication. The recent deal between the insurance company and a grocery store is the latest reason for everyone to support a pharmacare plan, a national public drug plan that will save money and, most importantly, will save lives too. All nurses have stories. We have stories about patients cutting their pills in half to save money. Those patients end up in the emergency department a few weeks later when only half of the medication is being taken and it's not doing its job. We have patients and families that are choosing between, does the parent get to fill their prescription that month, or does the child get to fill their prescription that month? That just shouldn't happen in a rich country as ours. A filled prescription means an empty seat in the emergency room. Now is not the time to give up on our cherished public health system and the 5 principles that ensure the system is there for everyone: public administration, comprehensiveness, universality, portability, and accessibility. Now is the time to invest in the public system, not selling it off to profiteers and private for-profit delivery. It's time to ensure that we have reporting mechanisms for those provinces that sit on the money instead of investing it in healthcare. And let's talk about it. Profit doesn't care. Profit doesn't care about working conditions. Profit doesn't care about the level of care that's delivered. Profit only cares about one thing: profit. We only need to remember what happened during the COVID pandemic with the private for-profit long-term care facilities and the patients, residents, and clients who paid the ultimate price. The Canadian Health Coalition is also promoting national standards for long-term care to protect all people living there and stop privatization in all forms. Just to recap, these next few days, putting the MPs and the senators on notice. We'll be talking about stopping privatization, investing in public health care, expanding the dental care plan, national long-term care standards, and pharmacare now. We've been working on it for over 2 decades. The time is now. I'll pass the podium over to Jing-Yi Ng, our clinical pharmacist, and Kieran Shoker, a clinical pharmacist from British Columbia.
Good morning. My name is Jing-Yi Ng, and I am a clinical pharmacist from Coquitlam, British Columbia, practicing in the areas of general medicine and surgery.
Good morning. My name is Kieran Shoker, and I'm a clinical pharmacist from Prince George, British Columbia. I work with patients who have cancer.
We are but 2 of many pharmacists across the nation who support a national pharmacare program. No one knows more about the problems with access to medications than pharmacists. Pharmacists are involved in many steps with the preparation, dispensing, and assessment of much-needed medication. I work in a hospital setting, providing care for my patients by creating the best treatment plan for them. But when they leave the hospital, they step into a wild patchwork of medication insurance across Canada. Cost becomes a real factor in their treatment. It's a confusing mess. Some people and some medications are covered in some provinces and not in others. It is so bad that some people pack up and move to a province that covers the medication they need. A national pharmacare program promotes equity by ensuring that all Canadians, regardless of income or location, have equal access to necessary medications, aligning with the principles of universal health care. Did you know in 2021, 21% of adults in Canada reported not having any prescription insurance to cover medication costs? This lack of coverage sometimes meant delaying or even not taking their medications as directed. This means more suffering and more demands on the healthcare system. With a national pharmacare program, patients are more likely to adhere to prescribed medications, leading to better disease management and prevention of complications, ultimately reducing the burden on the healthcare system. By consolidating drug purchasing at a national level, the government can negotiate better prices with pharmaceutical companies, leading to cost savings for both patients and the healthcare system. The Canadian Health Coalition has launched its Health and Hope 2025 campaign to advance a national universal pharmacare program as promised by the government in the Liberal NDP Cooperation and Supply Agreement of March 2022. Prime Minister Justin Trudeau committed in exchange for the NDP support to deliver continuing progress towards a universal national pharmacare program by passing a Canada Pharmacare Act by the end of 2023. Well, that hasn't happened yet. It's now 2024. We are calling on Prime Minister Justin Trudeau and his government to keep their promise.
As Jing mentioned, the patchwork of coverage for or no coverage at all for essential medications can have dire consequences for patients. The last thing cancer patients need to worry about is whether their medications for nausea will be covered or will they have to pay for them. In BC, patients do not pay for oral or intravenous chemotherapy as the province covers these essential medications. However, supportive care medications, which include medications for nausea and or vomiting, might or might not be covered by the provincial pharmacare program, multiple federal programs, or private insurance. I've seen firsthand the worry and anxiety that patients have if they cannot afford these necessary drugs. Unfortunately, there's been too many times when a patient's chemotherapy has been delayed while pharmacy staff navigate multiple insurance plans to ensure coverage. These insurance plans can include provincial, federal, private, or manufacturer patient assistance programs. The time that is spent related to drug coverage can be better used for patient care instead of these administrative tasks. Chemotherapy treatment can also decrease white blood cell counts. These cells are necessary for our body to fight infections. There's a medication that can increase these counts, and that medication, like the medication to treat or prevent nausea, might or might not be covered. If a cancer patient doesn't get this medication, they can develop serious life-threatening infections which require hospitalization. This is not the best use of our scarce healthcare resources, as this could have been prevented had the patient gotten the medication in the first place. Cancer and chemotherapy can cause blood clots. Medications to prevent and treat these also might or might not be covered. If a patient doesn't fill a prescription for these clots, it could lead to major disability or even death. These are just 3 examples of what I see in my practice. If there was a national pharmacare program, it would go a long way in resolving these issues. It would be better for patients, healthcare professionals, and the healthcare system as a whole. Now over to Vivian.
Good morning. My name is Vivian Eze, and I'm a licensed practical nurse in a long-term care facility in Whitehorse, Yukon. And I'm very pleased to be here to talk about healthcare and the work I do. Before I came to Ottawa for this Health and Hope lobby organized by Canadian Health Coalition, I worked the night shift on Friday to Saturday. I oversee the care of residents of varying ages who live with dementia, and we are desperately understaffed. Where I work, there is a serious shortage of nurses and care aides, even worse than in the cities in the south. My colleague and I work hard to care for our residents, but we cannot keep that up. Our employer gives us sign-up benefits or sign-up bonuses. Yeah, but that doesn't do enough to fix our working conditions or provide resources for care. There are more registered managers than the normal registered staff that actually do this work. And we care for our elderly residents, and they are really dependent on us. Now, we work below our core staffing numbers. Like our employers, they call it staff stabilization, and which is very much on the staffing. We work 2 nurses and 4 NHAs to care for 24 residents. And now, with the so-called staff stabilization, we are down to, when we have 2 and 1 down, there is no replacement. We just have to work with that, and that is what they call enhanced. For us, it is not enhanced. We're just working under our core staffing process. Now, this process puts staff under pressure, and we are prone to both injuries, both psychological, physical, and emotional. And to our residents, it subjects them to inadequate provision of care, as well as emotional and psychological stress, and reduced quality of life. We saw what happened during the pandemic: serious staff shortages, lack of funding, etc., all led to loss of lives. These things are easier now, but the big problem of staffing is huge in all care facilities across Canada. We also know the problem with systemic racism in healthcare. People living in low-income neighborhoods, many of whom are racialized, Indigenous, Black, and new to Canada, they all get poor care. This inequality is growing and is very unhealthy for a country like Canada, and I believe the gap can be resolved. I became active in my union because I know we can do a much better job of taking care of our neighbors, friends, and our fellow citizens. And I want to close by making a comment about pharmacare. You know, this is one of the things on the table right now on the Hill, and one of the things we are really pushing for. Inequality exists in Canadian access to prescription drugs. It is real. And 1 in 3 of working people don't have prescription drugs coverage. The less you earn at work, the less likely you are to have a benefit that covers prescription. A poll by Heart and Stroke and Canadian Federation of Nurses Union shows that 93% of Canadians think it is important for everyone to have equal access to prescription drugs. Most people feel that it's the federal government's job to make sure that this happens. That is what we are going to tell our elected people tomorrow. We need a national pharmacare plan so that people don't have to choose between putting food on their table and buying medication they need. We need to take better care of people. We need pharmacare, and we need to take our healthcare professionals seriously. That is what I am going to tell the ministers and the senators that I will be meeting tomorrow as part of this lobby day for healthcare workers on Parliament Hill. And I hand over to Frédéric.
Bonjour à vous. Je me présente, Frédéric Brisson, secrétaire général du syndicat canadien de la fonction publique, division Québec, et je proviens aussi du réseau de la santé en tant que préposé aux bénéficiaires en salle d'opération à l'Institut universitaire de cardiologie et de pneumologie de Québec, Université Laval. C'est long à dire, mais c'est ça. Je milite depuis de nombreuses années pour une assurance médicaments publique et universelle à payeur unique. Aujourd'hui, je suis devant vous pour vous dire pourquoi il ne faut surtout pas prendre le régime hybride de Québec comme modèle et vous démontrer pourquoi il est plus qu'urgent de mettre sur pied un tel régime. Au Québec, nous avons deux modèles de régime. Un public, qui est régi par l'assurance médicaments publique du Québec, la régie de l'assurance médicaments du Québec, excusez, et le privé, où l'employeur peut avoir une assurance collective, et si c'est le cas, les travailleuses et travailleurs n'ont pas le choix. Ils sont obligés d'adhérer à ce régime et prendre en charge la famille, soit les enfants et les conjoints. Le problème, c'est que le régime d'assurance médicaments, les régimes d'assurance collective augmentent de plus de 10 % par année. Et la cause principale en est les médicaments, le prix des médicaments. Savez-vous que quel pays de l'OCDE est premier en dépenses totales en médicaments par habitant? Et oui, c'est les États-Unis. Mais quel pays est le deuxième? C'est le Canada. Et si on sortait le Québec du Canada, bien, c'est le Québec qui serait deuxième derrière les États-Unis, avec des dépenses en moyenne de 1 116 $ par habitant, comparativement à 1 087 pour le Canada. Quant à la médiane de tous les pays de l'OCDE, elle est de 603 $, soit une différence de 513 $, ce qui est énorme. En avril 2022, nous avons sondé la population du Québec et les réponses n'étaient pas très encourageantes. 11 % des répondants ont dit ne pas prendre leurs médicaments parce qu'ils n'ont pas d'argent pour s'les acheter. 21 % nous ont dit soit sauter une dose ou couper leurs médicaments en deux pour pouvoir économiser. 25 % ont dû payer leurs médicaments en totalité parce que leur régime ne les couvrait pas. Et ce qui est très important à mes yeux aussi, c'est que la population a voté à 79 % pour que le Québec et le Canada incluent les médicaments d'ordonnance dans la couverture publique, tout comme le font les autres pays qui ont un régime d'assurance maladie. Parce que oui, nous sommes le seul pays à avoir un régime d'assurance maladie qui ne couvre pas les médicaments. Maintenant, je vous laisse imaginer ce serait quoi si on avait sondé les gens après la période d'inflation de 2022. Les gouvernements cherchent les moyens de faire économiser les contribuables et cherchent aussi les moyens pour que les employeurs réduisent leurs coûts. Une des solutions, c'est de mettre sur pied une assurance médicaments publique et universelle pour tous. Parce que tous les Canadiens et les Canadiennes économiseraient et tous les employeurs verraient leurs coûts d'assurance collective diminuer considérablement. Le gouvernement canadien serait le seul agent négociateur face aux compagnies pharmaceutiques, ce qui lui donnerait un pouvoir de négociation non négligeable. Les assurances collectives augmentent en moyenne 10 % par année, comme je vous l'ai dit tantôt. Mais le gros problème là-dedans, c'est que les augmentations de salaire ne suivent pas. Puis si on continue comme ça, les travailleuses et les travailleurs du réseau de la santé, ils ne seront même pas capables de se soigner eux-mêmes. En terminant, je tiens à vous donner un exemple concret. Prenons par exemple un préposé aux bénéficiaires au Québec. Un préposé aux bénéficiaires au Québec, en ce moment, il gagne 25,63 $ au top de l'échelon et fait 36,25 heures par semaine. Si on fait le calcul et on enlève les impôts, la part du syndicat, le régime parental et autres, il reste environ 2 300 $ net dans ses poches à la fin du mois. Ça lui en coûte 350 $ pour une couverture familiale pour les médicaments seulement. Il n'y a pas de dentiste là-dedans, il n'y a pas de physiothérapeute, il n'y a pas de massothérapeute, il n'y a pas de lunettes non plus. 350 $ seulement pour couvrir les médicaments. On ajoute à ça un loyer, qui sont de plus en plus coûteux et de plus en plus rares, qui sont environ au Québec entre 1 000 et 1 500 $ par mois. On ajoute à ça l'épicerie, mettons pour 3 personnes, 400 $ par mois, et je ne suis pas très, très généreux. Hein? On ajoute à ça les frais de transport, soit un transport en commun, la personne paye sa voiture, le gaz, l'essence et tout, donc un autre 300 $ qui est enlevé de ses poches. On ajoute à ça le téléphone, le câble, l'Internet, les assurances pour la maison, les assurances pour la voiture, et j'en passe. Faites le calcul, vite fait, là. Calculez-le. Il n'en reste plus dans les poches des travailleuses et des travailleurs du réseau de la santé. Il n'en reste plus pour les enfants, pour l'école. Il n'en reste plus pour les loisirs. Il n'en reste plus pour un bon souper au restaurant en famille. Puis encore moins pour être capable de s'en mettre de côté. Pour le bien de tous les Canadiens et toutes les Canadiennes, pour le bien des travailleuses et travailleurs de la santé qui prennent soin de vos familles, je demande au gouvernement fédéral et aux provinces de travailler en collaboration pour mettre sur pied un régime d'assurance médicaments public et universel pour tous, et ce, dès maintenant. Merci beaucoup.
Là, il ne reste qu'à remercier nos interlocuteurs aujourd'hui et la tribune de presse aussi de nous avoir reçus. So thank you very much to our speakers, Pauline Worsfold, RN from Edmonton, Frédéric Brisson, personal service worker from and union activist from Quebec City, our 2 star pharmacists from BC, Jing and Kieran, and our licensed practical nurse, Vivian. And I guess we'll just wait and see what happens in terms of interest from our colleagues in the media. But thanks once again to the press gallery. It's always a pleasure to come up here. We really appreciate it. Merci.
Merci. Thank you.